Hi, my name is Sarah Hahn. I'm a registered veterinary technician and adjunct professor here at the Des Moines Area Community College Veterinary Technician Program. And I am going to talk to you today about a couple of things regarding our sterile packs and our sterile pouches. We are going to cover both how to properly put an item into a sterile pouch. We're also going to go over how to open a sterile pack for your doctor as you're preparing for surgery, and then of course how to rewrap the pack as we prefer that you do that here at DMACC. This video is for my students. However, if you find it useful for your program, you are welcome to use it. So the first thing we're going to cover today is going to be how to put these kinds of instruments into our sterile pouches. Yes, there is a right way and a wrong way. So when we're talking about how to place them into the sterile pouch, the first thing you want to consider is how the pouch is going to be opened. For a lot of these pre-made pouches, there is one side to put the tool in. There is another side that is pre-sealed, and that will be how you open the pouch when you're ready to present it to your surgeon. With that in mind, and if your tool is one of these ringed forceps or a ringed instrument, then there is a correct way to put them in. Very uncommonly is there an instrument that doesn't have a specific way that it should be placed. But basically your goal is to place your tool in your pouch with the intent of opening it on this side, the seal side, and presenting it to your surgeon during anesthesia. So for this instrument, a lot of people are tempted to put it in jaws first into the package so that it would slide down and be point end, but unfortunately when you open it, then you would be offering point first to the surgeon, and that is incorrect. So you want to offer it with the rings or the handle, whichever your tool has, to the surgeon. Now, I'm going to try and turn it so you can see it. When you're putting these tools into these pouches as well, there is a right size and a wrong size for these pouches. You want to be able to have a pouch that is able to fit the instrument comfortably without too much extra space, but also not to the point where it is going to rip the sides. So if I come a little closer here and I show you that as I'm pushing this in, it's starting to compromise the seal on the outside there. So that means that this particular instrument needs maybe a larger pouch. So as we've already discovered, this pouch is not an appropriate size for this instrument because, again, when you go to put this tool in correctly, if you push it in more than it already is right now, it will start to compromise the seal on the outside of the packet, and that will compromise the sterility of the instrument. So we need to find something that's more appropriate. Unfortunately, this is our next size up that we have available. Obviously, this is larger than we need necessarily for this instrument, but just keep in mind that a lot of these sterile pouches are not titrated to the actual size of the instrument. It's just general sizes, and you just have to find what fits your instrument best. So, again, showing you up close, we want to put the ring side in so that when we present it to the surgeon, it will be ring side up and they can grasp it firmly and hopefully not drop a nice sterile instrument. So we're going to put this in, make sure that it is not ratcheted closed because we want to make sure that the sterile steam gets in between every nook and cranny. Place the instrument in here, and a lot of times you do not need a secondary indicator in these pouches because they do have a steam indicator right here at the top that says that if both of these indicators are a dark, deep colored brown, that means that this has reached the appropriate amount of sterilization. The next thing I want you to do is remove this strip here on the adhesive top layer. So removing that, and now you have, if you look closely here, this is sticky. And then if you look closely on the back here, you can see that this is perforated. So what you'll need to do in this instance is you'll need to fold it at the perforated line. And your intention is to have it be flat with no gaps so that when it's sealed, there is no space between the inside of the package and the outside of the package. It's another important reason that you want to make sure that the pouch is appropriately sized for your instrument. I've seen pouches where the instrument is so long that it is stuck underneath here, and that isn't making sure that we are not properly sterilizing or maintaining sterilization of our instrument. So do make sure that you have a little additional room around the end as well as the sides of your instrument so that we're not compromising the outside of the packages. So now that we have our instrument inside our sterile pouch here, we are going to go ahead and show you how to open it. So we've already positioned this so that when we open it, we are offering these rings to the surgeon so that they can grasp them firmly, get a good hold on them, and then be ready to use them. It's really important to remember that your sterile conscience, so you being able to be honest about whether or not you have broken sterility, is super important because it puts our patient's safety first, okay? So keep that in mind when you're opening these pouches, and be very cognizant of where things are sterile versus not. The outside of these pouches, even though they've been in the autoclave, these are our non-sterile environments. The inside of the pouch should be, the surfaces on the inside of the pouch should be considered sterile, as well as the instrument. So a lot of times I like to break the seals open on the very tips of these pouches to allow a little bit easier open, but the biggest one to open is going to be this long area here, okay? So usually what I do is I end up putting my thumbs along the opening like this and grasping them firmly in my hands, and then I will put pressure on my opposite knuckles and peel them apart using opposing equal pressure. And then as I'm peeling this apart and it's starting to open up here, you can see that because this pouch is a little bit bigger, I have quite a bit of room before I get down to my instrument itself. So when I get down to about this area, I kind of tilt it back, and then I use this almost as like a backboard as I reach down and grasp the end of the instrument, and then use the pressure of the instrument to pull against this white area here. At this time, I usually like stick a finger down here and pull back on this so that the surgeon can comfortably reach in there, and then I hand it to them like this. Notice that the only areas that the instrument is touching, those areas are the sterile areas. So the next thing that we're going to talk about today is going to be opening a sterile drape or a sterile pack for your surgeon as a surgical nurse or as someone assisting with a sterile surgery. So this pack that I'm using is just some gauze wrapped up in a surgical drape material. And obviously, as you can tell by the tape, it has not been used, it has not been autoclaved. Reminder that when our packs have been properly autoclaved, there are stripes on here, which you can see if you look closely, the pattern there, those will turn black, and they should be like a deep dark black, not brown, not yellow. Those two colors indicate that the sterilization process was not properly completed. The temperature did not reach an appropriate level, or the steam did not actually penetrate the tape and the material appropriately. So that will be kind of an issue that you will have to figure out what happened there, and obviously completely repeat the process. So if this was a sterile pack, I would expect it to have black or diagonal stripes on this, along with writing indicating who packed it, when it was packed, and the material inside. So remember, this is just for purposes of demonstration. So notice though that we've got tape that doesn't go completely all the way around. It does have ends that hook onto the back side, but they do not touch. That's very important to maintain sterility, and we'll talk about that when we're repacking it. But for the purposes of this, one of the things that I'm going to remind you a couple of times is where our sterile surfaces are, okay? This area out here, everything around the top that I'm touching is our non-sterile environment. Obviously by necessity, but also it's intentional, okay? So you'll peel this part off, okay? And usually after it's been autoclaved, it's gonna be far stickier than that. And a lot of times you'll be faced with something like this. It's hard to tell once you get this tab out which way it's going to fold, especially if you're not used to this method, okay? So the first thing I like to do is pull that tab straight out to indicate which way the flap will go, okay? Now that I know that it needs to unfold this way, I'm going to turn this around and lay it down. Now, preferably this would be on a mayo tray or on the doctor's available area, but not a sterile environment, because remember, the outside of the package is not sterile. You would never want to lay it on a sterile environment, such as a sterile drape, okay? So once you have this open, you can go ahead and remember, you can touch this bottom part here because it's the outside about ready to be exposed, but that is the last time you should be able to touch it. Also, when I'm putting this over this way, this should be the last time I ever reach over this pack, okay? We never want to put, basically think of the airspace above your sterile pack as also sterile area. So you never want to reach over the pack once the sterile environment has been exposed, okay? So we've opened up that first tab here, and then we're going to go ahead and open up this tab here, and I'm going to pull it off to the side. There is no, as far as we know, preference on which side you start with folding in, and therefore there doesn't seem to be a consistent way that people fold them in, so therefore there's not a consistent way we fold them out, okay? I usually hang on to this little flap and I grab the other tab and pull it directly opposing surfaces here. Now, as you can see, this little first end that we have has risen up. So two things I can do. I can either ignore it for now and hope that it starts to go down once we have things moving, or depending on if I have a mayo stand which is smaller so I can move around a surface, or if this is a large surface like this one, it might have to be a spinning of the material. But what I want to do is I want to go to one of the ends here and kind of pull it taut with the area that is folding up against one of the outside ones, okay? So pulling this just on the tips, because remember, we are now exposing the sterile area. You do not want to touch any more past the tips, because everything else is the sterile area, okay? So pulling that tight and making sure that it's taut that way, and then again, trying to get your ends to behave in this way as well. And then the last fold should be towards you. So again, grabbing this little tippy here and pulling it out, and it may cause one of the other folds to try to move back in. So add a little bit of tension on both of these tips here to hopefully prevent that from trying to roll in. However, if it does try to roll in even after you've given it a little bit of a tug here, you can also fold it against itself a little bit so that it has something to prevent it from automatically folding in. Now, if this is on a Mayo table, you are ready to present this to your surgeon. You can step away from it and they should be able to access it. However, if for any reason, especially we have a lot of our surgical packs, some of our surgical drapes are going to be double wrapped, then in this case, you are welcome to then pick this up. Remember when we were talking about the sterile pouch, how we talked about there is an inside and an outside, there is a sterile versus non-sterile. I'm going to pick up the bottom of this here and pinch it, okay? Pinching it here firmly on both sides, and then turn it so it is almost offered like a sandwich in a wrap, okay? So the reason I'm offering it like this is because I have my entire sterile environment facing the sterile material, and then I offer it to my surgeon to pull out the secondary wrap. Okay, again, it can be offered on the table as well, but if the surgeon is asking you to hand something to them so they can put it on a sterile environment, a sterile landing, because again, this part's not sterile, you can't start it there, right? Then this would be the appropriate way to hand it to them like this, okay? Now we are going to go ahead and talk about how to fold these back up. When we're folding these back up and we're wrapping a drape for autoclaving, one of the things you shouldn't see, and this is a pack that was autoclaved previously and was now being used as demonstration. What you should see in an autoclaved pack is some sort of indicator that looks similar to this, okay? This OK strip is an indicator of this pack reaching, the inside of this pack reaching full sterility, okay? So that is appropriate temperature. It has penetrated, the seam has penetrated the pack and gotten all parts of it properly sterilized. So when we are wrapping a pack and we have these OK strips, any pack that is not a pouch with its own built-in indicator should include a fresh OK strip. All right, so this is what it looks like before it has been used. The goal is for the arrow and the K to match the same shade as this O. As you can see with this one, it certainly does, right? It almost might be a little tiny bit darker, and that's okay. So where I want to put this is I want to put it in the middle of the pack because I want to ensure that the seam is going all the way through to the middle and reaching all parts of the pack, all right? So since this is just intending to be sterile gauze, I'm gonna put it almost like I'm making an OK strip sandwich, okay? And I can even fold the tip up or down so that the doctor can grab it and check sterility. Now that we've got that, we're gonna go ahead and start with our folds. A lot of times you will not have a drape that has these bends in it, but if you do have a drape that has all of these bends and creases in it, keep in mind that the last thing that this drape may have been used for may not have been the same thing that you were wrapping this time. So don't necessarily follow or rely on these creases, okay? So the first thing I'm gonna do is place it like a diamond and place my item that I'm wrapping in the middle. Now this was exactly what was wrapped before, so it's not going to vary very much from where it was before or how it was wrapped. So it's almost a little bit cheating, but some people prefer a fresh drape because you don't have the other creases to influence where you're folding them because you don't know that the previous person folded it correctly in the first place. So keep that in mind as well. When we're folding this, the first thing we're going to do is cover it up, and we're starting our inside fold. So first thing I want to do is, like a gift, I want to push it all the way up against the material, and I want to pull it tight. Then where that edge is, I want to fold back the drape and let it rest wherever it rests when I press it down. There is still a little bit left over here, so I'm going to fold that back so that it's still tucked well within the confines, the size of the material that's being wrapped, okay? Then on this side, as I mentioned before, if you skipped this part of the video, what I had said was there's not a universally accepted or preferred way to start when it comes to the sides. In other words, there's no standardized side that you're supposed to start with. So you can start with either the right or the left, whatever you feel comfortable doing. The most important thing is to kind of put a little bit of pressure on the side that you are wrapping and almost wrap your fingers in it. You want this to be pulled taut and tight and have it lay flat to the surface of the thing you are wrapping. And then you will come over and flatten all of this down so it's nice and flat. And then you see you still have this excess when we have the edge of the gauze right here. So we're going to fold that excess back. And again, like wrapping a present, you're going to flatten it out and smooth it down. And then we have just a little bit of a tippy here, so we're going to kind of fold that back and just tuck it in so it's not in the way, it's not hanging over the side. We have our second side now, so again, I'm going to repeat what we did for the first side and pull that nice and tight. Get your tension and pull against your finger here and the edge of what you're wrapping, and you're going to pull it tight and tuck it in. Notice that I'm only removing the pressure from the top of this as I'm pulling and covering this over, okay? So I'm not taking away the pressure, I'm just exchanging it from one hand to another. Now, as you can see, again, I have this overhang here, but now this is the outside of my pack, right? So I really have to make it look nice and not allow areas that could break sterility. So I'm gonna fold it again, fold it back here, smooth everything out, and then again, I wanna keep this little tip here from sticking out on the side, so I'm gonna fold that back. And this is the last part of it, which gets a little bit complicated, especially if you are not used to doing this part. Now, you're thinking probably, oh, we're just gonna fold it and do what we've done before. Not necessarily. We want this to be tucked in so that without tape, this is a hopefully stable pack, right? So usually what I do is I spin it around so that this tail is facing me, and then I put that pressure again on that edge where I'm going to be folding. I fold it very tight by applying that pressure and pulling against it. And then instead of folding it like normally when we were doing the other flaps, we would fold it back and over. Instead, we're going to come down here. There are all of our layers from our sides, and we're going to take this excess on the top, kind of fold it in and under, and we're going to very gently feed it in. We are not stuffing it in there. We are not wadding it up. We are very gently, almost reverse folding it inside this little pocket that we have made, okay? The goal here is to have, again, that really nice flat look, because we have, again, not wadded it, we have just folded it in half inside there. And then you leave this little tab so that whenever someone is coming to unwrap it, just like we did in the beginning, they're starting with that nice little tab. Notice how this pack is not going to fall apart. The old standby joke is to see if you can throw it against a wall and it stays, so it does. What we're going to do then is we're going to apply a piece of tape. I mentioned it before, but I'll mention it again. We don't want the tape to go all the way around. We just want it to cover the opening. We'll cover the tab. I am going to pull it up so it looks nice and neat. Put that tape down and around. You do want it to go past that edge, that opening a little bit, so that we are making sure that it doesn't break integrity, right? We're really sealing that shut. And then again, it's not touching on the back. You still have a little bit of space. And then you are going to take this and write your initials. And we want to note the expiration date. A lot of clinics will just do the date that it was packed and autoclaved if it was the same day. And then you want to mark what was in here. So in this case, it is 4x4 gauze, and there are 10 of them in there. So a lot of times I'll put 4x4 gauze, sterile gauze, quantity 10 or something like that. You want people to look at it, read it, and know immediately what is in there if they need it. So that is very important. So again, today we covered our sterile packs and our sterile pouches, and hopefully that was helpful to you.